Was in private practice for about 4 or 5 years, and my partners and I decided that it was an opportune time for us to transition out of private practice. It was a seamless transition, and actually it was much more painless than I would have anticipated going into it. The messaging has always been, this is your practice. It's your practice, these are your patients.
The ability to change my practice to fit my patients' needs has been tremendous, and there's always new projects that we're working on, new ways to improve our patient health. We work on grants and other projects that might improve our patients' access to health care. I do feel very supported with leadership. I feel that they, I could call at any time and speak to multiple leaders, and I feel that they value my input and how I feel about certain topics.
As a physician-led organization, Ochsner allows each physician to add their own personal mark and to treat the patients truly as they feel they would treat anyone that they were friends with and that they're, caring for. And I think the patients feel that. I think they know that they are truly loved and that the doctor enjoys being with them and taking care of them.
The most important intrinsic motivators for any healthcare provider really revolve around mastery, autonomy, and purpose. And I think that Ochsner is seeking physicians who want to master their craft, give them full autonomy to do so, to pursue a very noble purpose and mission around improving the health of a population.
In Baton Rouge for primary care, there's usually 2 weeks out of a year that we're on call right now. When we're on call, we really only get phone calls or messages between the hours of basically 5 to 8 o'clock the next morning. So for instance, last Friday, I was at my child's baseball game and I get a message from the nurse asking, is it okay to refill one of my partners in the community's patient's Lantus insulin? I'm able to pull it up right there, look at it, pull the chart in, and within 2 minutes respond back to the nurse and say, yes, that's fine. And she writes back, yes, and it was done.
The system in place to cover for our partners when we are expected to be away is pretty robust and pretty complete, so that you can take the time that you need, whether it be for health reasons or family leave, to actually be present for those experiences and not dread the deluge that's waiting for you when you come back to work.
Ochsner has allowed me to be a mother. And often my patients will come in and I'll say, I'm a full-time mom, I'm a part-time doctor, but when I'm here, I'm here. It's been a beautiful, seamless experience with Ochsner as I've had children.
Ochsner's been brilliant with their implementation of Epic and all the additional features and innovation that Epic has to offer. With that, we're able to use our Epic call system to be able to do secure chat or to see messages or results or to look at patients' charts from the beauty of your smartphone. We are constantly on the cutting edge of getting new updates, innovations, and also working with our providers to show them these techniques and tools. So for primary care in Baton Rouge, the call is actually one of the best features, I would say. I cannot explain enough how valuable this resource is. Because basically when patients call in or they have questions or concerns, they can call our 24-hour nursing hotline and they actually get a nurse. There, the beauty behind using the implementation of the Ochsner nursing call and the Epic system, they're able to send me a message directly. So they don't have to play phone tag with me. And when they do, it links it directly to that patient's chart. And this only happens 2 weeks out of the year. So it's pretty sweet.
Well, I think their favorite thing about the Ochsner system is actually Epic and the portal and their ability to get messages straight to my staff. And that allows us to send secure chat messages to other providers. So if I'm worried about a patient and I need to get them seen right away or I need to speak to another member of their team, then I can send a message directly to that person and get an efficient and quick response, and so we can get the patient what they need, and so everybody's on the same page. So it's actually extremely helpful for the care of the patient as a whole, and the patients like that. Sometimes I'm in the room with them, seeing them, and I send a message to the doctor as I'm talking to them, and we get a response sometimes even before the patient leaves the office.
They're on the forefront, the cutting edge when it comes to digital medicine, when it comes to access to the pharmacy. I feel that Ochsner has really allowed me to change my practice with the times.
We also have things like digital medicine, where patients can be managed. Their blood pressure and their hypertension and their diabetes can potentially be managed from home with the access to Ochsner's digital medicine program. So that's been really good.